combines aromatherapy, acupressure, and lymphatic drainage techniques to deliver numerous positive effects to your clients. This massage improves blood circulation, enhances cell metabolism and detoxification, relaxes tired muscles, and provides many health benefits to the body. Key pressure points are located along meridian lines, described in Chinese medicine as the energy channels that connect the internal and external body. Accessing these pressure points during the massage can encourage energy flow through the body and lead to an overall feeling of wellness. Because we perform this massage with essential oil blends, we're also generating a therapeutic effect on the body, both physically, such as clearing the sinuses, and psychologically by inducing a sense of calm and relaxation. This dermalogica touch therapy can be completed like all touch therapies in 15 minutes. The movements can be adjusted according to the client's needs, and most movements are repeated between 3 to 6 times. It is ideal for all skin conditions, even acne or sensitive skin, and is especially convenient for clients contraindicated to European-style massage. Before beginning the massage, make sure you're at the correct height. Your client should not be completely flat, but the movement should be able to be performed with relaxed or dropped shoulders, with the hands resting on the client's forehead. Expose the client's ears, neck, and chest, as this technique incorporates the entire face and upper body. Select the correct dermalogica additive or botanical mixer for the client's skin type from the information gained through the consultation and face mapping skin analysis. Step 1. Apply 4 to 6 drops of the additive into your hands. And gently press between your palms to bloom the essential oils, and then box press onto the client's forehead and jawline, onto the cheeks, and lastly apply to the neck and chest. To ensure adequate slip and glide, lightly spread with fingertips across the chest and back up to the face, finishing at the temples. Step 2. Hover your hands over the nose and ask the client to take a few deep breaths through their nose to begin the relaxation process. As the client inhales the aromas of the essential oils, they travel through the nasal passage and are picked up by receptors and transferred to the olfactory bulb. The olfactory bulb is closely connected to the limbic system of the brain. The limbic system is responsible for stimulating emotions and memory and can evoke feelings of pleasure and calm. Step 3. Gently rest your fingers just above the ears and place the thumbs in a V formation between the brows. Apply a medium pressure over the frontal vertical lines and move up towards the hairline using a pressure directed slightly down towards the client's feet. Use your own body weight to initiate the correct pressure. By rocking into the movement with correct posture, you avoid discomfort in the hands and wrists without heavy exertion. This movement is working on the frontal sinuses and frontalis muscle and can help alleviate tension and stress. Press, release, and then move up to the next area. Repeat 6 times. Step 4. Continue with alternating thumb sliding movements over the frontal vertical lines towards the hairline. These gentle strokes encourage lymphatic drainage and help to smooth and relax this area along the governing vessel meridian. Repeat 6 times. Step 5. Divide the forehead into 3 horizontal sections: brow, middle, and hairline. Position the thumbs just above the brow line, press, release, and glide out from the center towards the temples, and then slide out in front of the ears. Move up to the middle of the forehead and repeat the press and release movements. Be sure to lighten the pressure at the temples. Move up again to the hairline and repeat these pressure point movements. This provides additional release from the frontal sinuses, and the light drain movement pushes lymph towards the pre-auricular lymph nodes. Once the 3 sections have been completed, repeat these steps again 3 to 6 times. Step 6. Use the fleshy part of the thumb known as the thenar eminence. Begin at the center of the forehead and slide over the forehead to the ears. By sweeping out and off at the ear, sinuses are cleared and tension is released in the frontalis muscle. Step 7. Rest thumbs in a V position between the brows to act as a pivot and keep fingers steady. Using cushioned fingers by placing the middle finger on top of the index finger, begin at the top of the nose inside the eye orbit, pressing against and down on the nasal bone. Imagine where your spectacles would sit. These can give incredible relief for clients suffering from allergies or that experience heavy puffy eyes and sinus headaches. Press, release and drain out above the cheekbone to the top of the ears. Next, press below the cheekbone where the flare of the nostril meets the cheek. From the nasal fold, sweep the middle and index fingers one after the other, draining out to under the ear. Work each of the sinus points, followed by the drain, alternately. By working the maxillary sinuses along the large intestine meridian, we can relieve sinus pressure and congestion. The drainage technique encourages the movement of lymph and can reduce puffiness and swelling. Repeat these movements 3 to 6 times. Step 8. Clasp fingers at the center of the jawline and drain along the jaw and stroke back to behind the ears to the mastoid lymph nodes. And massage the ears between the index finger and the thumb. Begin at the earlobe and work up towards the top of the ear. In Chinese diagnosis, they believe the ear is a microsystem and represents the entire body. The lobe is the head, the outer cartilage is the spine, and massaging inside the ear affects the internal organs. Overall, working the ear brings about total body relaxation, well-being, and balance. Repeat 6 times. Step 9. With full hands, lightly drain the jaw and the forehead, one after the other, with alternating movements. First drain the jawline back towards the ear, then drain the forehead with the fleshy part of the thumb to the top of the ear. This encourages detoxification of the tissues, pushing lymph to the anterior and posterior auricular lymph nodes. Step 10. The jaw drain movement has 3 steps. Number 1. Make as if to scoop the jaw with the sides of the hands and curl the fingers upward. Drain back along the mandible using the little finger side of the hands. 2. Once you reach the ears, invert the fingers down and drain down the sides of the neck, avoiding the front of the throat to the clavicle. 3. Separate fingers at the clavicle with the index and middle fingers and drain out and off at the shoulders. This fluid movement helps to further detoxify the skin and the body by working towards the submandibular and cervical lymph nodes. Repeat 3 to 6 times. Step 11. Slide the hands out to the shoulders and press down on the front of the shoulders towards the floor 3 times with a gradual press and release. This stretches and releases the pectoralis major muscle. It's excellent for easing rounded shoulders due to shortened pectorals. Now pivot the hands and press with the heel of the hand on the top of the shoulders towards the feet 3 times with a press and release. This stretches and releases the trapezius muscle. By applying pressure to the shoulders, we can release upper body tension and loosen tight, constricted muscles. Step 12. Glide around the shoulders and up the back of the neck to the base of the occipital ridge. Here you will work 5 key points or acupressure hollows along the occipital ridge. Point 1 and 5 are located behind the ear and at the start of the occipital ridge. You'll feel a slight indentation or hollow. These 2 points are connected via their energy channel to the back teeth and the ears and fall along the gallbladder meridian. Applying rhythmic pressures helps with headaches, TMJ issues, and fatigue. Points 2 and 4 are located further in, approximately 2 centimeters or 1 inch on either side of the spine. And if looking down on the face, they'd be directly behind the eyes. These points are connected to the top teeth, throat, and frontal sinuses along the bladder meridian. Working these points assists with neck stiffness as well as nasal congestion and can help with headaches and migraines. Point 3 is the highest point along the occipital ridge. By following the spine, you will locate this hollow, which falls along the governing vessel meridian. Massaging this point brings about total relaxation and helps to reduce stress. Perform 6 circular-like movements on the 5 points, 1 and 5 together, then 2 and 4 together, and finally point 3 alone. With reinforced fingers, use a pumping action by rolling the fingers back towards you, with pressure into the point and then releasing. Use firm to medium pressure upwards on the occiput and then release. Step 13. The cradle movement is optional for the neck. If the client has experienced spinal injuries, whiplash, or received surgery in the neck area, avoid this final step. Begin by cupping the neck in one hand. Place the forearm flat on the bed and move the client's head to the right with their ear resting on your forearm. Support the first hand with your other hand underneath and rest your other forearm flat on the bed. Gently rock the head between your arms so the client feels secure. Slowly move your arms towards the side of the treatment bed, keeping forearms in contact with the bed. This can be done by lunging or stepping to the side. The client's head must stay straight and level. Do not lift it. Feel for any resistance and check on the client's comfort. The muscle affected the most is the sternocleidomastoid. Be cautious and do not overstretch the neck. Complete the stretch on both sides of the neck and bring the head back to the middle. Gently release hold and bring the hands up to cover the ears. Pause for about 30 seconds and gently release as the client exhales.